Welcome to this press conference and thank you so much for coming here. Apollo Hospitals Hyderabad in collaboration with Anatomize 3D MedTech Private Limited. We started a 3D printing process here in Apollo Hospitals. I am very happy to inform you that this is one major boon in our surgeons' hands. And it gives a lot of precision, it helps patients, it helps doctors. So we are very happy that we started this particular thing here, and we have done a couple of cases. The doctors are here. Dr. Ruma Sinha, who is a senior most gynecologist and robotic surgeon here, and she did this case. Dr. Chinnababu, who is our senior surgeon, oncosurgeon actually, so he used this particular technology and benefited. Dr. Rajiv is an orthopedic oncologist, so he also used this particular thing. Dr. Gokhale, who is our cardiac surgeon, has also used this particular thing. Unfortunately, he is stuck in the operation theatre doing the surgery, so he is not able to come. Friends, I will not take much time. I will have introduced the panel here. They will explain you exactly what they have done, how it is benefited them and also benefited doctors, the patients. And I also thank the delegation who has come from Anatomized 3D, who are here with us in this press conference. Thank you so much for coming and being a part of this particular conference. We appreciate your presence here. Thank you so much. So should we, Madam, can you start? You want to give a brief? So Dr. Ravindra Babu, who is our Director of Medical Services, Apollo Hospitals, Hyderabad region. He will give you a little introduction to the entire subject, then we'll go in details. We'll go into details with each doctor, what they have done, how it is important in today's world. Thank you so much. Dr. Ravi. Yes.
Yeah, good morning to everyone. So we are very proud to announce this technology. It's 3D modeling technology, which involves a 3D printing. Now, this particular technology is useful at least in three ways, at least in three levels we have seen this is going to be useful. One is, that in the first case, we use this technology in the operation theaters. Generally, you all know that the surgeons operate looking at the CT scans and MRI scans. Now we have a different, that's a 2D vision, that's a two-dimensional vision. Now a doctor while operating has a 3D vision, 3D image where he is able to operate very complex surgeries. By using this technology, we are able to reduce the trauma, we are able to make the things much more better, and sophisticated surgery becomes a little simpler. I think the doctors will speak for themselves, their experience with this technology. So that is one area where we are seeing. The second area is, you all know that when we do surgeries, some patients have implants in their body. These implants are manufactured in industries. They give us different sizes and we try to pick up which is the best size suited for the particular situation for a patient, and we are implanting. With the help of 3D technology, we are able to print exactly what the patient needs, an implant exactly customized to the patient and put it for the patients. Thereby, the surgery's outcome is going to be much more superior than what is currently available. This is the second place where this technology is going to find a place. And the third one is where, that medicine is always learning. It's always learning. We keep teaching, we keep improving. So we are able to educate our students or the people or the doctors using these 3D models. It becomes much more simple. The students understand better. So these are the three areas where we think this technology is going to be there. Believe me that this technology is going to be the future. It's going to be a real thing. It's not one time. It's going to be there with us. I think more and more people will be using this technology and for a better medical outcome. Thank you.
Dr. Ruma, can you start?
Good afternoon. Thank you all for coming today to for us to share our experience with something so exciting and so new. I'm a gynecologist and laparoscopic and robotic surgery. I deal with women having a lot of problems with their uterus, ovaries and tubes. The commonest problem that women actually face today is a problem of fibroid uterus, which is a non-cancerous condition but troubles women in three aspects. It can give them bleeding problem, it can make them infertile, or it can just give them a large tumor which they want to be treated for. Mostly these women, as they have no cancerous condition, they also today like to do their surgeries with minimal access. That means small hole surgeries or keyhole surgeries as we call it. Now I'd like to share with you the experience we had with a young patient or young lady who actually was not even married, is in her 20s, she is looking forward to get married, have children, but she has this kind of uterus with so many tumors. To give you a perspective, a normal uterus should be this size. And look at the size this particular lady has developed. Now, the challenge remains that this particular young patient does not want an open surgery because she is young, she wants cosmetic surgery, she does not want something that is a midline open surgery. So we offer them laparoscopic, and today with our very advanced technology that we have of Da Vinci Xi system, we are actually offering them robotic surgery. But to me as a challenge to surgeon is that when I'm operating with these small holes, for me to understand where all the tumors is, to be able to remove all of them is sometimes visually challenging. I do my CT, MRI before. Before this technology came, I used to do my MRI. Today also I do my MRI and understand where my fibroids are and then go in for a surgery. But with this model, like if you can see, I'll just open and show it. That's okay. I'll just open and show it to you. This is the model of a uterus. Now, if you open, all these red ones are her tumors. So to be able to identify all these 12 tumors while I'm doing my surgery with a robotic technology, I may miss one or two of them because if I look externally, this is what I see. I can't understand from outside where my tumors are lying. But with this technology, when I make a cut on her uterus, I know exactly where to proceed to be able to get these tumors out. So we could share with you the whole case history with the correlation of which tumor where and how we removed all these tumors for her. She did well. She went home the next day. She's recovering very well right now. And we saved her uterus. It will be future useful for her to conceive, have children. So this is how we are trying to make a difference to young women with complex myomectomies so that they can have it minimal access surgery like robotic surgery with this technology. Thank you.
Dr. Chinappa, you want to say something about your case?
Yeah.
Please. Telugu. Haven't been anything.
అందరికీ నమస్కారం. ఇక 3D ప్రింటింగ్ టెక్నాలజీతో మరి ఒక క్యాన్సర్ సర్జరీస్ కూడా ఎంత బాగా చేయవచ్చు అనే ఒక నిదర్శనాన్ని ఈరోజు మీకు చెప్పాలని ఆశిస్తుంటున్నాం. ఒక యవనస్తుడు 42 years old జెంటిల్మెన్ మా దగ్గరికి వచ్చినప్పుడు ఆయనకు హార్డ్ ప్యాలెట్ అంటే ఒక ప్యాలెట్ సెలవరీ గ్లాండ్ యొక్క ట్యూమర్ ఆయనకు ఉండింది. సో దానికోసం ఆపరేషన్ చేసి ఎంటైర్ ఫేస్లో ఉండి బోన్ అంతా తీసేయాలి, మ్యాక్సిలెక్టమీ అంటాము. సో ఈ యొక్క సర్జరీ చేసినప్పుడు రాడికల్గా ఈ ఆపరేషన్ చేసినప్పుడు కొన్నిసార్లు ఐసైట్ కూడా ఇబ్బంది అవుతుంది. సో కాబట్టి ఈ యొక్క సర్జరీ చేసే ముందు అసలు ఈ ఆపరేషన్ ఎలాగో చేయాలి, ఎంతవరకు దీన్ని మనం తీయగలము సేఫ్గా అనేటువంటి ఒక రిహార్సల్ అటువంటిది ఇక 3D ప్రింటింగ్ వల్ల మాకు జరిగింది. సో కాబట్టి ఆపరేషన్ ముందుగానే ఏ భాగాలు మనం తీయవచ్చు, ఎంత తీస్తే ఆంకలాజికల్గా కంప్లీట్ క్లియరెన్స్ ఇవ్వగలము అనే దాన్ని కూడా మేము ముందుగానే సిద్ధపడి ఆపరేషన్ దగ్గరికి వెళ్ళడం జరిగింది. ఈ విధంగా ఎక్స్టెంట్ ఆఫ్ రిమూవల్ ఆఫ్ ద ట్యూమర్ అంటే ఎంతవరకు తీయాలి అనే దాని కొరకు కూడా ఇక 3D ప్రింటింగ్ వల్ల చాలా మాకు లాభం దోహదపడింది, ఉపయోగపడింది. అంత మాత్రమే కాదు, ఆపరేషన్ కూడా చాలా తక్కువ సమయంలో చేయడానికి వీలు జరిగింది. అట్లనే పేషెంట్ కూడా త్వరగా కోలుకుని ముందుకు వెళ్ళడానికి కూడా ఇది సహాయపడింది. కాబట్టి ఈ యొక్క 3D టెక్నాలజీ వల్ల పేషెంట్కి ఎంతో సహాయపడుతుంది, ఉపయోగపడుతుంది. సర్జన్కి కూడా ఎంతో సులువుగా ఈ ఆపరేషన్ చేయడానికి కూడా సహాయపడుతుంది. అంత మాత్రం కాదు, ఇందాక మరి డాక్టర్ రవి గారు చెప్పినట్టుగా ట్రైనింగ్స్ ఇవ్వడానికి కూడా జూనియర్స్కి, యంగ్స్టర్స్ కూడా ట్రైనింగ్ ఇవ్వడానికి కూడా చాలా ఉపయోగపడుతుంది. సో కాబట్టి ఆంకాలజీ సర్జరీస్లో 3D ప్రింటింగ్ అటువంటిది చాలా మేలు, ఉపయోగం చేస్తుందని నేను భావిస్తూ ఉన్నాను. థ్యాంక్ యూ సో మచ్.
డాక్టర్ రాజీవ్.
Good afternoon, everybody. I am Dr. Rajiv Reddy. I am an orthopedic oncosurgeon, that is a bone cancer specialist. As a bone cancer specialist, we routinely deal with big tumors which are in difficult locations like the pelvis, spine, and the limbs, especially around the knee joint and around the shoulder joint. And as a tertiary center, we have facilities to deal with such big tumors and save limbs, whereas a few years ago these limbs would have been amputated or cut off. And thanks to the facilities at Apollo, we have done a huge number of big tumors which would otherwise have been amputated. One extra addition that has been extremely valuable to us is the 3D printing, which we have used even before. And this has really helped us because 3D printing gives us a realistic physical model of the anatomy, especially in difficult sites like the pelvis and in the limbs, where you have a lot of nerves, vessels, and other structures around the normal bone as well as the tumor. So when we get a model in which the tumor is shown in red color and the normal bone is shown in white color, just as Ruma ma'am just showed us, this makes it easier to explain to the patient the complexity of the problem, the risks involved, and they understand the surgery better. And we all know that in the 21st century, it is important for us to communicate and explain to the patient what is being done so that they understand the problem fully well. Not only that, this helps us plan the surgery much better because we have a 3D model in front of us instead of 2D MRI or CT images. So this makes our surgery easier. There is less surgical time involved, so overall the patient recovers quickly and they get discharged quickly and their overall cost is much lesser. So what I would like to say is that 3D printing and 3D implants, that is personalized implants, as Dr. Ravindra Bapu sir told us, personalized implants, plates, nails are going to be here, and they are going to be what we are going to do more and more in the future because everybody wants something that is personalized and customized to them. That is the reason why I think Apollo Hospitals Jubilee Hills launching this facility is a big boon for the orthopedic surgeons and the orthopedic oncology community in specific, because orthopedic oncologists deal with very complex problems and big tumors, where such 3D models and 3D implants will definitely help us and more importantly help the patient and make sure that they recover with the full tumor removed and have as good limbs as possible. Thank you.
Any questions? Okay, if there are no questions, then thank you so much for coming, and please kindly make sure that this message goes well in the community so that patients will get benefited, doctors will get benefited. So it's a great technology which we started. So kindly make sure that we promote this to benefit the patients. Thank you so much. But to have one group.